Dibitoxin Myobloc is an injectable solution for the treatment of cervical dystonia to reduce the severity of abnormal head position and neck pain associated with CD. Myobloc is available in 3 vial presentations and is licensed under the name Neurobloc in the EU and other countries.
The Myobloc comes in a 5,000 per cc vial and also comes in a 10,000 per 2 cc vial. So usually you would start off with the lower dose first initially in a patient that you're injecting for cervical dystonia. You would also use 0.9% normal saline, and the important part here is using preservative-free normal saline, because if the saline has preservatives in it, it could actually denature the protein of the botulinum toxin. So you would initially, depending on the dilution that you wanted, you could do a 1:1 solution, which you would then do 1 cc. If you wanted to do a 1:2 solution, you would then draw up 2 cc's. If you want to do a 1:3 solution, then you would pull the syringe up to 3 cc's here. I usually draw a little bit past that, so then I can get it exact, and you notice some fluid coming out, getting rid of any air bubbles there. Then what you would do is you would take the 5,000 unit vial, and today what we're going to do is we're going to go ahead and use just a 1:1 mixture, so I'm just going to dump the rest of this out, and you would go ahead and inject that into the vial, getting a 1:1 mixture. Now, if you do a 1:1 mixture, and the desired dose is 250 units, you would use 0.0 ml. If you want a 2,500 units, you would then use 1 ml of normal saline. If it was undiluted, it would be 0.6 mLs of the Myobloc, would equal 2,500 units. Okay. So this is a crude drawing of, you will see the sternocleidomastoid muscle here, and typically there are 2 ways that you can do the injection method for botulinum toxin. You can either do it by palpation and feel. In this case, you must know exactly the function of the muscle and how to activate the muscle. And also you want to palpate both sides to make sure that the muscle is equal on both sides and one muscle is not more dystonic than the other. So the second method you could use is by EMG, in which you know that there are several different cervical dystonia patterns, such as retrocolus, lateral colus, anterior colus, and then you would go ahead and use an EMG needle and inject, actually take the EMG needle into the muscle, see the abnormal activity, and see which muscles are dystonic, and then inject the botulinum toxin into those muscles. So we have the sternocleidomastoid here. This can be involved. His pattern was lateral colus. However, his sternocleidomastoid was not involved, but his scalenes were involved, and you could have the anterior, middle, and posterior scalene muscles here. And then also there is a muscle called the levator scapulae, which is there, and also longissimus, which would be here, and also the splenius capitis and splenius cervicus here. This device here is a signal amplifier, and this is a portable, smaller type version of an EMG machine. However, an actual EMG machine would be a better device to use. However, this is nearly just as accurate. And so you have your EMG needle here, okay? And you basically place this right inside there, and you place these electrodes here on the patient's skin. This is the actual EMG needle here. you would just, you already have the Myobloc drawn. You just attach it as so here, make sure that the numbers are visible to you. And then you remove the top. And you want to use, typically it's wise to use gloves with this. And then you would actually cut on the machine. And you would go ahead and inject into the muscle there. And you would hear the abnormal muscle activity, and then you would go ahead and inject the Myobloc. In this, you have the patient activate the muscle by turning his head to the opposite side and pushing into my hand here with your chin slightly. Turn like this, turn that way. And then you would activate the sternocleidomastoid muscle here. Then I have him turn to the opposite side, and I would palpate the opposite side. And you could work by palpation to see which muscle appears. If there is a dystonic muscle, you should be able to palpate a different intensity within the muscle belly. And so, other ways, if you want to palpate for the anterior posterior scalene muscles, they're in this region here, and now you palpate on the other side in order to feel, to make sure the muscles that you're feeling are even. And you can do this with the semispinalis capitis muscles back here, as well as the splenus cervicalis muscles also. And also for the levator muscle, you could also palpate to make sure that both of them are, feel the same to you on palpation. So you could use an EMG method, or you could use a palpation method for injecting botulinum toxin. So with cervical dystonia causing abnormal postures of the head or neck, the cervical dystonia can also cause a significant amount of pain. A large percentage of patients, which could be up to 50 to 75% of patients, can experience pain with the cervical dystonia. Cervical dystonia could also be multifactorial and multi-directional and involve a complex group of muscles. So you may have actually two patterns instead of one. Once the patient is injected with botulinum toxin, it usually lasts 3 months. Some patients may have a shorter range of effect, and it could last anywhere from 8 to 12 weeks. Also, the major side effects of botulinum toxin can be dysphagia, which is difficulty in swallowing. With Myobloc, there is more incidence of dry mouth, and also weakness of the muscles of the weakness of the cervical muscles. So typically, it's good to inform patients that within the first 2 weeks, they may have some slight difficulty with swallowing, or they may have some difficulty holding their head up. But however, this should go away within 2 weeks. If not, the patient should be instructed to call to notify you of this. And also, if there is any increased dysphagia or difficulty swallowing, to where the patient is coughing or having, that can indicate that there is contents going into the lungs, and the patient may be at increased risk of aspiration at night, and that patient should be reevaluated in the office as soon as possible. There are several strains of botulinum toxin. The Myobloc strain, botulinum toxin type B, there seems to be evidence that Myobloc, botulinum type B, does appear to help patients that have more pain with their cervical dystonia than some of the other strains. There's also information in the literature suggesting that injecting the Myobloc not sooner than every 3 months, or any botulinum toxin no sooner than every 3 months, decreases the risk of the immune system developing antibodies to the botulinum toxin. Now, there are tests through Athena Diagnostics that will test for antibodies to botulinum toxin. But typically, if a patient is getting good effect from botulinum toxin and then the effect is being lost, then typically what a physician would do is switch from one type of botulinum toxin to the other type, because more than likely, if you switch from type B to a different type of botulinum toxin, then you may not have antibodies that the antibodies will not affect the botulinum toxin of a different type. There are many patients with cervical dystonia that may, as you will see, have a delay in their diagnosis or be misdiagnosed. Some of this may be because of the different types of cervical dystonia, not only with cervical dystonia patterns, but there may be different varieties of movements with cervical dystonia, such as tonic, which the muscle is fixed at a certain in contraction, such as a Charlie horse, which is a certain type of dystonia that everyone is more familiar with, or it may be clonic, where there is clonic contraction of the muscle that may even represent a tremor. This head tremor could be mistaken for essential tremor or Parkinson's disease. Also, there are a large percentage of patients that have cervical dystonia that will have true tremor as well. Also, there could be a mixed type, which the dystonia can be tonic and clonic, to where there's tonic contraction and clonic contraction of the muscle. In order to get an accurate diagnosis for cervical dystonia and avoid misdiagnosis, it's important to go to a physician such as a neurologist who specializes in movement disorders, either a neurologist in the community who has done a fellowship in movement disorders, or someone, or a neurologist at an academic center who exclusively sees movement disorders such as cervical dystonia and has a significant amount of experience treating these patients. Also, quality of life is also important when initially talking to patients with cervical dystonia, because the patient with cervical dystonia can be affected by depression, social embarrassment, functional impairment, and negative body image. Also, when you're first discussing the treatment plan, it's important to discuss that this may take several injection sessions in order to get the muscle pattern correct or to see a significant effect from the botulinum toxin. Also start off at the lowest possible dose when you are injecting to see how the patient tolerates botulinum toxin, and then slowly escalating the dose per muscle group as the patient responds to it, and having the patient also describe to you, the pain and also the type of relief the patient is getting from the botulinum toxin.
The mission of Tremor Action Network, acronym TAN, is to spread awareness of essential tremor and tremor-related movement disorders by advocating for a cure through research. Perhaps someday, in the not-so-distant future, medical researchers will find a cure. Current studies have suggested associations between essential tremor and Parkinson's disease and between essential tremor and dystonia.